think it's time for us to put this controversy to an end. We definitely need UVB to synthesize vitamin D, which is not only essential for bone health but is also mandatory for a good skin and hair. There are factors apart from sun exposure that are important when we talk of synthesis of vitamin D. Number one, we Indians need 3 to 5 times more exposure to sunlight to synthesize the amount of vitamin D compared to our Caucasian brethren. Number two, if the patient is overweight or obese, no matter how much you're in the sun, you would not be able to synthesize enough vitamin D. Number three, if you're certain medications like birth control pills, they may impact your vitamin D metabolism. Number four, the very tan that you get by sitting in the sun prevents the absorption of enough UVB to make vitamin D. For example, if we sit in the sun to synthesize vitamin D, we Indians develop a layer of tan which protects us against skin cancer precisely because UVB cannot enter deep in the skin. So the same tan also down-regulates vitamin D secretion. So I feel ethnically Indians cannot synthesize enough vitamin D even if they sit in the sunlight for prolonged hours. But those prolonged hours in the sun without usage of sunscreen puts you at a risk of developing pigmentation, tanning, premature aging and wrinkles. All this can be thwarted by your daily supplementation or weekly dosage of vitamin D that you can approach any doctor for. So I would say a vitamin D supplement through food or through a oral tablet would do you more good than sitting in the sun. Remember, ethnically, we Indians cannot synthesize that much amount of vitamin D even if we sit for long hours in the sun. So if you want a healthy hair and skin, do ask your doctor to prescribe you a vitamin D supplement depending on the level of vitamin D in your blood. And a good sunscreen with high SPF would go a long way in protecting your skin from far-lasting damage that cannot be undone even with a supplement. Now the FDA had banned the usage of terms 60, SPF 60, 70 as they found there was no difference in efficacy between sunscreens which are 50 or sunscreens which claim to be 70 or 80. A SPF of 30 protects us against 97% of UVB. It is slightly more with a sunscreen of higher SPF, but any SPF higher than 50 does not guarantee you more sun protection. Rather, it might give you a whitish cast, and I would deem it as a useless product. It does not justify their more cost and usage. I would say sunscreen is that daily regimen, daily thing that cannot be missed. So it's a 365 days, 7 days a week usage of sunscreen that can guarantee us a blemish-free or a tan-free skin. It's very important for people to understand that clouds allow 80% of UV rays to penetrate. It does not block UVA, which is causing premature wrinkling and photoaging. So we tan more on a cloudy day compared to a hot summer afternoon, partly also because we get negligent or careless with our sun protection behavior. So it is far more important to put your sunscreen if it's raining, it's cloudy. It's equally more important that you put a sunscreen when you're near sand and water. So I would say sunscreen is the minimum thing that we can use on a daily basis if we want to take, a bare minimal thing that I can do to give myself a good skin. It is daily usage of a sunscreen all throughout the year, all seasons, all days, all weathers. I think this is one of the biggest misnomers that patients have about sunscreen. Any sunscreen, be it a higher SPF as well, requires a reapplication after 3 to 4 hours. So it is mandatory that when we are outdoors at least, we reapply the sunscreen every 3 hours. This application duration can be 2 hours if you're near the sand or water. It can be even 80 minutes if you are going through your swim. So it is very important for you to reapply your sunscreen during the day to gain maximum benefit. So just using a sunscreen is not enough. Using in the right amount and reapplication every 3 hours will actually give you the sun protection that you're looking for. Anything that offers us sun protection is an added benefit, but I do not think that a moisturizer or a foundation with a minimal SPF is enough to protect you against the harmful effects of UVA and UVB. It should be supplemented by a sunscreen. This is one of the biggest myths that most of the patients and consumers have, that my foundation has a SPF. It is not enough, it gets diluted by the other excipients and active ingredients. It's very important you top up even such a product with a good SPF sunscreen.
To book an appointment with a cosmetologist or a dermatologist in your area, please visit www.skinandhairacademy.in.